Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. After birth, hospital staff are going to make sure they check your baby to ensure that they are healthy. Today we'll be talking about everything you need to know and you can expect about medications, tests, and procedures that will be provided to your new baby. So click those like and subscribe buttons and stay with us. For starters, you may be wondering, what is the first thing they're going to do with your baby? Well, they're going to want to do a physical exam to make sure your baby looks healthy, and that starts with the APGAR score. The APGAR score is a score between 0 and 10, and it's looking for 5 different things about your baby: their appearance, their heart rate, their reflexes, their muscle tone, and their breathing. Each one of these is given a number between 0 and 2. And the total is added up to give a score of 10 or less. This gives providers an idea of how well your baby is, with a 10 being a perfect score. Next, they're going to weigh your baby and they're going to measure your baby. First of all, you guys want to know how big that baby is. Everybody's so excited to learn this. But additionally, this tells us how well your baby grew inside your belly. They're going to check the belly button because this is where the umbilical cord attaches to the baby. They want to make sure the umbilical cord has been cut and clamped properly and that the belly button looks good. And then overall, every single day that you're in your hospital stay, they're going to take a really good look at your baby and make sure the baby looks good. We often do a hearing screen in the hospital on your baby. And this confuses a lot of parents because they're like, how is a baby supposed to perform in a hearing screen? So what happens is they're going to put special headphones on your baby and they're going to attach some electrodes which have stickers on them to the baby's scalp. These electrodes measure the brain waves of your baby when the baby hears sound. Then light, gentle sounds are put through the headphones for your baby to listen to. If the baby can hear them, that's great, your baby passes the hearing screen. If not, they'll usually try to repeat the test one more time while you're in the hospital. But some babies don't pass even on the second time. Now this can be for a couple of reasons. One of the main reasons is if your baby's been moving around and hasn't been fed. So we usually ask that you feed the baby and allow us to use a pacifier. If the baby still is not passing the hearing screen, this could simply be due to fluid inside the ears left over from birth. If this is the case, they will give you a referral for you to have a repeat screening when the baby is about 6 weeks of age. There are some medications that we're going to offer to your baby while they're in the hospital. The first one is the hepatitis B vaccine. It's offered in the hospital because your baby would need a total of 3 vaccines in order to get fully vaccinated. So it's usually offered at birth, between 1 and 2 months of age, and between 4 to 6 months of age. The hepatitis B vaccine is usually offered in the labor and delivery suite. However, you do have the right to ask for it not to be given, and you can have it given at a later time if you choose. The next one is the vitamin K shot. This is a shot of vitamin K, which is a vitamin that helps the baby's system learn how to clot blood. When you clot blood, this keeps you from bleeding out when you have a cut. This is a life-saving medication that is so essential for most newborn babies. And this is because we normally get vitamin K from our intestines. Right now, your baby's intestines aren't producing that vitamin K, and there's not enough of it in their formula or their breast milk. Finally, we offer the erythromycin ointment in their eyes. This is to help prevent disease in their eyes or infection caused by bacteria that they've been exposed to in the uterus or the vagina. Please remember to hit the like and subscribe button so you can get our latest content. One of the things that's going to happen is the hospital is going to offer the newborn screening test. This is a blood test for rare but serious diseases. Some of these diseases, if they are not treated within the first few days of life, can cause serious issues or even death for your baby. The test involves pricking their heel to get a few drops of blood. This blood is collected on a special lab slip that's sent to a state lab. The results are usually ready between ages 5 and 7 days of life. If there's anything abnormal, they are going to call you to find out what's going on with the baby and let you know the results. They're also going to send those results to the pediatrician and to the hospital. This test, depending on your state, tests for up to 24 plus diseases that are extremely rare, and it's very important that you get this test done. One of the things that we're going to do for your baby is a critical congenital heart disease test. Oftentimes your nurse will come in and call it the heart test. This is a test that measures the oxygen level in your baby's hand and your baby's foot at the same time. It's very non-invasive, it doesn't hurt your baby, and it's super easy. They can even do it in the room in front of you. What they're going to do is they're going to take these special stickers that measure oxygen level and they're going to put them on the hand and foot. They'll turn on a machine that then measures the oxygen level. Normal should be less than 3% apart. So 100% and 98%, for example, would be a normal reading. If the measurement is farther apart than that, they may go ahead and repeat that the next day. If they still have an abnormal screening, your pediatrician may recommend further testing, including having a cardiologist come see your baby, as well as doing a car seat test. A very common thing that we're going to test for in the hospital is jaundice. Jaundice is the measurement of bilirubin in your baby's blood. This is because 50% of our babies will develop jaundice within 2 to 4 days of life, and jaundice, if left untreated, can cause serious lifelong effects to your baby. The first test that we may do is a transcutaneous test. This is where they take a machine that just presses the skin to measure the bilirubin through the skin. If this test is high, then we will do a blood test where we draw some blood using a heel stick. If that is too high, then your baby may require some treatment, including phototherapy. This is a special light that's applied to the baby's skin to help reduce the bilirubin in their system. We will also ask you to feed the baby often and make sure they're peeing and pooping, as this assists with treatment. I hope this video has helped you learn everything you need to know about the tests, procedures, and medications your baby will receive in the hospital. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.